Hello and welcome to the Weight Free Wellness Podcast. I'm Tara Bachland, your hostess and the creator of the Weight Free Wellness Podcast. And today we have a very inspiring guest. I like to not only share the experts in the fields, but people with really inspiring stories. And truthfully, honestly, many of them are experts in their own endeavors. And so we have with us today Jessica Day, and she has a very unique story, and I'm very, very happy to have her on as a guest. I met her, just a little bit of background, I met her at a wellness expo here in Minnesota, in Minneapolis. And when I was walking around just looking for guests, honestly, that's what I was looking for. Great stories, great people, things that are either products, people, services that are truly unique. And I definitely found this in Jessica. And, I was at the table where she was displaying and talking to people. And I was talking to one of the other ladies at the table. And before I left, she, in just her presence, just kind of grabbed me. And if not just by her sheer words. And I could tell, and this is exactly what I've been looking for, and I look for in the Weight Free Wellness Podcast, are people who know that they have an inspiring story, something to share, and most of all, they want to help others. And as she told me her story and made sure, essentially, without forcing me to sit down, she made sure I sat down and listened to her story. And I was so glad that she did, so that I could then hear more of her story and share it with others, because I think many of you can be inspired as well. So I want to welcome Jessica Day. Thank you so much for making the time to be here. Would you start out by just sharing with me and the audience, what is the ailment that you have suffered from, I believe, since you're a child, right?
Yes, I was born with a condition known as cerebral palsy, or mild spastic diplegia. This condition prevents the normal development of motor function, and my muscles are stiff as a result. This primarily affects my lower extremities, and it is not a disease, it is a physical condition.
So what's the difference between a disease and a physical condition?
A disease is something, communicable and something that it would be deteriorative, if you will. My condition will not get worse and will not get better with age, and you cannot catch it from anybody.
That's very interesting. And I didn't know the difference, honestly. I sometimes think this podcast is like a health class that we never really got in school.
Yeah.
So what was it like then as a child? What were you experiencing? Just to give us kind of a background.
Well, to give you kind of an overview of what's affected as a result of my disability, my perception of balance is off. Like I said, my muscles are very tight. In early childhood, I experienced spasticity, so the shaking and rigidity of my muscles, and I had little stamina and a lot of physical pain as a result of my physical condition. And before seeking out innovative alternatives, I used 2 crutches, and 50% of the time I would use a mobility scooter and not even walk at all. A lot of my childhood was consumed with trying out different medications, Botox, and undergoing very invasive surgical procedures.
What kind of invasive procedures would you mind sharing?
Bone rotations and putting in metal hardware, like pins and plates, to sort of assist my body in not caving in on itself, if you will. My knee would turn in often, and just support my body, because you don't really have that much of a foundation when your muscles are weak. And an associated impairment or a co-condition of cerebral palsy can can be abnormal bone growth.
Is that something that you experienced as well?
Yes.
Did you find
Yes.
that any of those typical procedures helped in any way?
You know, I wasn't really exposed to alternatives until later in life, and I'd have to say, from my perspective now, I mean, there's a time and a place for these procedures, but I'd say only half of the surgeries that I've undergone were actually helpful. And otherwise, there just really is what I would call a trade-off, especially in traditional surgical procedures. That is to say, for every ability I may gain as a result of a surgical procedure, I will lose another. So a great example of that would be, my legs might be straighter as a result of a bone rotation or implanting metal hardware, but I will lose range of motion. You see?
Mm-hmm. Yeah, and it really, I can see that that's definitely a trade-off. How about did you say bone marrow tapping?
I said bone rotation.
Oh, bone rotation. That was, okay. And it sounds like, I mean, you're already in pain. And so these procedures, I mean, you had to have been such a coin toss, to decide to go through these procedures with a hope that there could be some improvement.
Well, when I was younger, I really didn't have anything else to compare it to, so I didn't really acknowledge that I was in pain. And a lot of that, although my father was very good at involving me in decisions in regards to a surgery or any procedure I underwent, a lot of that was just my parents' desire for me to live as normal a life as possible, and just really, not being the experts and not knowing what to do. So they would often listen to the doctors. And so it was really just their desire to get me up and going. And of course, I really, as a young child especially, I really didn't mind the differences between me and my peers. I didn't let it affect me, but at the same time, I didn't let my physical condition get me down.
That's something I really noticed about you, that when I met you, it seemed like it wasn't just because you found these new therapies. It seemed like that was part of your character.
No.
That you're just I don't know if you'd want to say fighter, but you're definitely, looking up, if not at the horizon, looking ahead and not looking down, which is great.
Mm-hmm. Thank you. Yeah, and that's, an outlook that I would encourage other people that are faced with physical conditions, whether you're born with it or it's thrust upon you because of an accident, try to remain positive. I have always identified and will always identify as an able-bodied person. I don't like labels. I will not label myself.
That's awesome. So is that something that you grew up with? Do you think that's totally the way you are, or did you read something or go through something that you just decided to be that way?
I did go through something, but that was later, after I was done with college, and I'd be willing to share that with you in just a minute. But I also want to talk a little bit about the fact that I had a very large family. I was not an only child. I grew up with many siblings. My mother and father were very family oriented. I did grow up in a split household, but there was no lack of love or compassion. And, my parents, both of them, they never really looked at my disability as a burden. And they had the same expectations for me as they did my other siblings. And I think that's what really impacted my life in my younger years.
That's quite a message there. There's a lot in just those few sentences that I think even help parents, who may be a child in this condition. Is it a hereditary, or is it genetic, or
No, it is not hereditary or genetic. It is just a common occurring physical disability as a result of being deprived of oxygen for a period of time before, during, or after birth. And my mother had a really tough pregnancy with a lot of bleeding.
Yeah, I think it's helpful to know information. We can be so scared of ailments or diseases and so forth, but when we have information, it can help. But also, I think what you're saying too is you can be aware of the information, but it doesn't have to be your personal all-time truth. Like you said, you don't see your brother as a disabled person.
Yes, and too, with this condition, cerebral palsy is just an umbrella term. And so there are varying degrees, and there are, various ways you can be affected by this. And then, of course, there's co-conditions, and it all depends on the individual. So I really like to represent, the smaller percentage of people who, have very mild conditions and can function and operate within society, just the same as anybody else, because I think there's this underlining fear of disability, no matter what that implies for the individual, that it just isn't accepted and it isn't, normal. So it must be something to be feared. And it's not that at all. We really need to look at it as an individual situation. And before you judge somebody with a disability, you need to look at them as an individual.
Mm-hmm. Definitely. Well, I think you're speaking well for that cause, for sure.
Thank you.
Yeah, for sure. So give us some highlights. It sounds like you went to school normally, you went to college, you went through the normal, what most people would consider normal stages of life. And then, so maybe hit a few points on that. And then where was the point that you started getting into, quote, alternative therapies?
Of course. Well, I can give you a little bit of background on my education. I originally grew up in Prior Lake, and I attended Prior Lake school districts until I was in 9th grade. After 9th grade, I attended a charter school because they weren't giving me an adequate education. Again, they were the Prior Lake school district had put me in special ed classes based on my physical disability. So I found an environment that was more suitable to me, and I actually ended up graduating early. I graduated when I was 17, and I started college at the Art Institutes International, Minnesota, right downtown Minneapolis, and that is a private art school. And I have a degree in graphic design. From there, I've always been a huge supporter of stem cell research, and, I had been researching it since I was 10. By the time I was in college, before that was made available to me, and I'll get into that later, I was done with the surgical interventions. I was done with trying to change my physical situation, and I was just really ready to experience life. And I think that everybody, no matter what it is you're going through, reaches that point when they're dealing with something that they're forced to deal with on a daily basis, where you just got to accept it how it is and move forward and be the best you can be.
Is that the turning point that you were mentioning earlier?
Yes, that was the turning point. And I actually, I continued to look up information on stem cell treatment. And while going on vacation with family, I had just, I was curious as to California's stance on stem cell treatment. And so I looked up various clinics, and I came in contact with the Cell Surgical Network. And that's a network of professional doctors and surgical techs that help with bioidentical stem cell treatment. And that's using stem cells from your own body, from your fat. And one thing I really appreciated about the Cell Surgical Network and my doctors there is that they looked at me and my goals as a person, and they didn't make me any promises. They didn't give me any, expectations. They didn't say, well, we can address this problem. They just saw me and what I wanted out of life, and they encouraged me to, instead of thinking about what my body can't do, they encouraged me to rethink that and think about what my body is capable of doing for itself. And I've had 3 stem cell treatments as of now, and I'm walking independently without the use of crutches, and I don't even own a mobility scooter anymore. So I don't spend any time in a seat or a device similar to a motorized wheelchair or anything like that. I will occasionally use one crutch to go long distances or walk my dog, just because, I'm still dealing with the balance issues.
Mm-hmm. That's pretty terrific. When was your first treatment?
I received my first treatment when I was 22.
So just for reference for some people, how long?
I'm 24.
So 4 years ago, within 4 years, you've received 3 treatments.
Mm-hmm.
And you went from, how often did you have to use the wheelchair, or I'm sorry, I don't remember what you called it.
Mobility scooter. I chose not to use a wheelchair because I didn't like the fact that people could come up behind you and direct you where they wanted you to go, or push you aside. I don't come up to anybody and direct where they're walking. So that was my choice to use a mobility scooter. But like I said before, I used to use a mobility scooter about 50% of the time before I received any stem cell treatment.
That's terrific. I have to smile too, because I think that's a great representation of your attitude. You didn't choose a wheelchair because you didn't want anyone else directing you to where to go. And that shows your stick-to-itiveness and your self-directing demeanor. That's really cool. Mm-hmm. There's so many metaphors like that in life.
Yeah, there really is.
So what are some other benefits that you felt from the stem cell therapy?
Well, my first treatment was really profound. And for me, I experienced positive results the same day of my first treatment. And one of the most impactful improvements that I have had is the fact that I'm no longer in constant pain as a result of my disability. And that goes back to what I was trying to explain before when I was telling you my perspective as a kid. I didn't know anything different from my condition. I wasn't able to recognize that I was in pain because I had nothing else to compare it to.
So you had a significant reduction. It must just felt heavenly, I bet.
Mm-hmm. It really did. And when you remove pain, there's so much more room to focus on other things. So I have improved as far as multitasking, fine motor skills. My brother's mom, my half-brother's mom, is a hairstylist. And so, I grew up with her and dealing with, what kind of style I wanted and, maintaining my hair and just making sure that I looked good every day. And I couldn't braid my hair growing up, and now I am able to braid. So it's fine motor skills like that, or typing, that, people take for granted, but once it's freed up and you're able to do that, a whole new world opens up to you.
Absolutely. And what I love about sharing stories like yours is it is so easy for us, and I will say even me, to take for granted what I can do on a daily basis. And, perspective is so helpful. We need to have perspective. And now I see that each time I've seen you, you have very lovely hair and hairstyle. So that's evidently something it seems that you like to do.
Well, I'm a creative by nature, so, expressing myself is really important.
I'm continually inspired. I can't wait to dig in more and ask some more. So you were saying, obviously the first treatment was really significant. Did you see much? How long was it from your first treatment to your second treatment?
I want to say a little over 6 months.
Did you see much change from the first? Like, was there a lot of regression, or was it?
All of the improvements that I've experienced as a result of the stem cell treatment have held steady, and they just build on each other. I can say that my second stem cell treatment and my third was a little more subtle, just because I wasn't in as much pain after the first treatment, and all those little things like improvements in fine motor skills and slight improvements in my perception of balance, they all build on each other. And really, the stem cell treatment works best if you work with it, and it's not without effort. I need to keep physically active. I need to work out as much as possible in order to keep my body up and running the way I want it to. But I think that goes for anybody. If you just sit on the couch and eat potato chips all day, you're not going to be doing too well. So it's very much the same for me. And especially after the 3 months after stem cell treatment, it's important to stay active. I believe that helps the whole process along. And one of the drawbacks, I do have to say, that I feel I've experienced as a result of the stem cell treatment is the loss, and this is going to sound weird, but I'll explain it here in a minute. The loss of tension, muscle tension, throughout my body. Although that is a wonderful thing, and of course it reduces my pain, I don't really have a foundation of strength. My muscles weren't really strong to begin with. So I'm in a stage of rebuilding, and I'm not here to convince anybody to undergo stem cell treatment one way or the other. I mean, you've seen the media, I'm sure, and we could sit here and argue whether stem cell treatment works or not, or should be used. But I suppose where I stand is, this is my personal experience, and nobody can say otherwise. And as far as, using your own body and its resources to help improve your health, I don't think anybody has the right to regulate that.
That was something I was just writing down as you were speaking earlier. I do want to get into the laws and regulation and such. I would like to cover real briefly, though. It sounds like I'm not trying to get into a whole medical discussion of what's going on, but it is, to me, it's fascinating, that it sounds like your body is basically...
I'm sorry?
It sounds like your body is basically regenerating. And so it needs training. And what is it? Maybe you can explain to us simply, what are the stem cells doing? Where are they going? And what are they doing?
Well, first, you must understand, I'm not a medical professional. I'm just somebody who's gone through this procedure. And the way it was explained to me is that stem cells will react to the chemical signal in, and this is a hypothesis, of course, because they can't know for certain. And you can't, one of the downfalls of stem cell treatment is we can't direct our cells to a specific area in the body. They just naturally go where they're needed in the body through responding through the chemical signal that your body gives off. If it's injured, be that an old injury or a new injury, a minor injury, or a significant injury. So that's the way it was explained to me, that the stem cells go where they need it based on chemical signals your body gives off.
And on your website, you do have a video where you show the process, you going through the process. Was it the first time?
That was my second time, and I'm working on a documentary. I've been working on it for quite a while because I don't have a lot of documentation of my younger years and to use as a comparison due to a house fire that my family experienced when I was young. So I've been piecing together this documentary as best I can, and I'm hoping to make it available to people as soon as possible.
Is there any help that you need that we could put a shout out for assistance, or do you got it all under control?
If anybody wants to look up my work on aspireability.com, and if they like what I'm doing and perhaps they have a background in video editing, or they just want to contribute to the nonprofit, they're more than welcome to do so, and they can contact me directly.
Wonderful. So getting into a little bit what you were mentioning before, one thing that when we first met, you made it really clear that, the stem cell therapy is from your own tissue. It's not fetal stem cells. Maybe you want to clarify on that for a moment before we get into the legal and regulation issues.
Yes. First off, stem cell treatment, from what I've observed and what I know from talking with my doctors, has come a long way. And fetal tissue was really used for research purposes, or for those who don't have a strong enough immune system, or their body fights against them and their cells aren't healthy. That's the only time in which they would even consider using that, if at all. They usually try to use adult stem cells because your body won't reject them, so they prefer to take it directly from you, or from a family member, depending on, what's being done and the facility. And I would have to say, my facility that I go to only uses adult stem cell treatment, and they only use cells from your body. And I would warn against any stem cell clinic advertising that they have the best cells available, because the best cells available are cells from your own body. That's what's best for you.
And it makes sense. The more it is genetically matched better and so forth, I would assume.
Well, it's much, I guess from my perspective as a patient, it's much like, organ donation. It needs to match up. It needs to, it needs to be responsive with your body and to your body.
That makes sense. So what are some of the regulation and law issues, obviously from your perspective and knowledge?
Well, right now, it is not an FDA approved procedure, but the clinic I go to is FDA compliant, and that goes back to, the research and the fact that you can't direct stem cells, and some would argue, you don't know what they're doing, but I'm here to argue it's my own body, and I'm less afraid of that than I am to go under the knife and have, a foreign object placed in my body for whatever reason to improve, some aspect of my condition. I would want to use my own body and my own resources. And one thing I like about the stem cell treatment is there isn't that trade-off that I was talking to you about earlier. I don't have to sacrifice anything in order to receive these treatments and by extension receive the benefits. And I mean, this is a really hot topic right now, and a lot of people would say, and I've had people say to me, well, you feel better just because it's a placebo effect and you want to feel better. Well, I'm not going to get into the logistics of that because I'm just somebody experiencing this, but I can tell you as a person who's dealt with CP all her life that the improvements that I've seen cannot be faked. I cannot fake better range of motion. I cannot fake my ability to balance or my ability to keep myself upright and stand still for a period of time. This is something, especially with a condition like cerebral palsy, where, you can't fake this. There is no in between. You either can or can't do something. And so that's just where I stand.
I think that's a worthy of definitely taking a good listening to, for sure. It's not like someone has a cold and you're like, don't take the cough medicine,
Yeah.
We say has experienced to a much greater degree how it has impacted your life.
Exactly. And, this is a personal choice. And, something that might work for one person won't always work for the other. But definitely, this was kind of my point of transition because I started looking at my body and what it can do rather than its limitations, like I was saying. And so that led me to explore other natural alternatives, if you will, because where some people would argue that stem cell treatment is the epitome of Western medicine because it uses technology and it is a minor surgical procedure, from my perspective, it's still my body doing for itself. My cells are a natural resource, and so I view it as natural.
Yeah.
And so I started respecting my body much more than I had before, and I wanted to look at ways that I could treat it, better and with dignity and respect.
So I think maybe we could assume what you would mean by respecting your body, but would you elaborate a little bit on that?
Not not looking at my body and what it can't do as something bad, not, taking medications for pain or, contemplating surgery because it's the only option, presented to me in a certain environment. Just allowing myself to be me without trying to make drastic changes, and allow these drastic changes to happen naturally through the use, not only through using stem cells, but other modalities, relieving muscle tension through massage and, just kind of mind over matter techniques using meditation and so forth, and just not focusing on what I am, not capable of doing physically, and not defining myself by the definition of my disability.
Wow. That's needs to be put on a shirt or something.
I don't know about that. But, if more everyday people, whether they have physical disabilities or not, saw, just how normal my life is, and people like me, how normal their lives are, if there wasn't this stigma attached to disability, I think a lot of people would be able to reach that point of respecting their body much easier, because it wouldn't be, disability wouldn't be looked at in a negatively, and it wouldn't be looked at as a problem to be dealt with.
Mm-hmm. And you're saying such golden nuggets, I think, and I've talked about them in my own health and wellness journey, and I wouldn't encourage people. I don't encourage people to compare, but I can't help but say, to be very honest, I can't help but say what I've been through is, I'm sure, a fraction of what you've been through, but the principles are the same, no matter where you are at in life. And what I really appreciated what you said too, is that you said in the environment, the options that I had. And it's another concept. I talk about him fairly often, but Bruce Lipton, The Biology of Belief, and how he was involved in early cloning back in the 60s, and how his teacher taught him, if something's going wrong in your experiment, look at the environment. Look at the environment of the petri dish, and even how those experiments went even beyond that, and look at the expectations of the experimenter or the environment of the cells on a greater scale. And I picked up on, and maybe didn't even mean to say it, but it's like, I think you've been saying it all along too, is that you opened your mind up to other possibilities, and therefore you put yourself, at least mentally, in a new environment. And then physically you found the new environment of options and resources that are available. Exactly. Opened your mind.
Exactly. And I'm a huge believer of the law of attraction, or you are what you think you are, if you will. And so I've just been trying to abide by that through my journey. And, it's drastically changed my life. Now I am doing my work with Aspirability Resources, and, it's just getting off the ground, and I'm really enjoying it because it's helping others. And that's sort of, a kind of fulfillment you don't get in many positions, So I feel really good about my decision to, enter into the advocacy and wellness industry. I just finished studying light energy and LED light therapy through Solis Academy. And that's one of the modalities I experienced personally and really helped me with pain management. So I'm looking forward to, my future in this industry and being able to help others like me. And as far as, comparing conditions, I have a lot of people that, say, oh, well, what I've gone through must pale in comparison to what you've had to deal with. And, I always, have to tell them, well, no, because we're all given what we can handle in life. And, that's your personal experience. And, your trials and tribulations are not my trials and tribulations, but they can have the same impact. So if there's anything anybody takes away from this conversation, it's, to really, like I said, look at the individual and, don't pity somebody because it looks like they have a less fortunate situation than you do, because, looks can be deceiving. And I have a very enriched life, and I went to school, I got a higher education, I have a wonderful job, I'm doing what I love, I have a wonderful family, and just all in all, a normal life. I have a great social life, a wonderful network of friends, and I feel very blessed. And it's no different from what anybody in this world would have, and if they don't, no different from what anybody else would deserve,
Yes. Great perspective. It reminds me back when you said you didn't know how much pain you were in because that's all you knew, and then our own lives are our own perspective. Yeah. We only know what we know in that similar way.
Exactly.
Yeah.
Exactly. And, just because my family, recognized that I was in pain during that time doesn't mean I dwelled on it or could even recognize it or to its fullest extent. Let me be very clear. Obviously, pain is pain, and I dealt with my disability and how constricting it would be. But I never knew to the degree how much it impacted me as far as pain went. But sometimes ignorance like that can be bliss. Just let the person, go about life the way they see fit. Don't hold them back from anything by any means. And my attitude is really the only reason I was presented with the opportunities that I was as far as stem cell treatment. And then, I took the personal initiative to seek out stem cell treatment. But then, I made the commitment to treat my body with respect and seek out alternative modalities beyond that.
So share some, it sounds like light therapy, which I do want to get into more in depth. Was light therapy the main alternative therapy, or were there others?
Mm-hmm. So I've participated in meditation, massage, and I've had chiropractic work done, and craniosacral therapy, and aromatherapy, and LED light therapy, just to name a few of the modalities I've seeked out and tried myself. And those would be the most impactful for me and my condition. And like I said, I was so taken aback by just what my experience with light therapy that I have seeked out an education in it. And now I'm working at a facility called the Wellness Circle, and it's a wellness center in Lino Lakes, and they have a vast array of alternative modalities available, and they're all here for the same reason, to provide alternatives to their customers and clients, and promote well-being no matter what you're faced with. And so I feel very fortunate to be a part of this network and to also be surrounded by these independent business owners, most of which are women. And I'm a young entrepreneur. So, like I said, I feel very blessed.
Definitely. I would like to learn more about share some more about the light therapy. Maybe a little bit of what you experienced, how much it decreased your pain, and overview how it works.
All right. Well, first, before I start, I'd like to clarify that I'm speaking from my personal experiences just to paint you the best picture possible. But as a light energy practitioner, or light energy technician, I cannot treat, cure, diagnose, mitigate, or prevent any condition. Light therapy is used to support the body and take the body out of fight or flight, and that is to say, from a state of stress to a state of relaxation. It's researched by NASA, and I use an FDA-cleared light device because it's not a medication or anything you consume. It is then cleared. And the light device I have is an Elon light machine, and it utilizes color and light and frequency, specifically salvagio and Nogier frequency, to help support the body. It is an extension, depending on how you look at it, it is in some ways an extension of chromotherapy or color therapy, which is the use of color to evoke certain bodily or emotional reactions. And studies have shown that light therapy helps the production of ATP, which is what your cells use to communicate with your body. It also helps to regulate your circadian rhythm, or your internal clock, if you will. And it helps improve blood flow by increasing natural nitric oxide within the blood. And better circulation leads to a better immune system and overall health.
So what kind of people come in to seek this therapy?
A lot of people that I've seen have back pain or spot pain. And some, are just stressed and they cannot, get their body out of that state of stress. They cannot relax. One thing that I noticed during my first experience with light therapy, and that I've noticed with clients of mine, is that the light machine kind of assists the body in reaching a deep meditative state without the effort of meditation, and like I said, helps to reset the your circadian rhythm or your internal clock. And obviously, when we can get better sleep, we're headed towards optimum wellness.
That's for sure.
And again, as a practitioner, I can only speak in terms of wellness and help in supporting the body. I cannot treat, cure, diagnose, mitigate, or prevent.
Understood. So can you share the experience you had in your first treatment?
So my first treatment was with another local practitioner, and she, wanted to see what it could do for me. And after spending an hour on the lights, like I said, I just felt relaxed. Often with a condition like this, like mine, you can get what's called an associated impairment or associated depression. And, for as positive an attitude as I have, my limitations can get to me sometimes. And I think I speak for everybody when I say, you can't, every day isn't always, your best day, but what matters is that every day you put your best foot forward, be it a good day or a bad day. So it helped me relieve my stress. And after an hour on the lights, it really felt like kind of similar to an alignment. My body just felt more aligned. My muscles felt more relaxed. I felt rejuvenated. And I actually was able to hop off the table and walk, and I wasn't wearing my shoes. And that's very difficult for me because I have what's called a leg discrepancy, so a difference in limb length as a result of a botched surgery. So I have over 2-inch difference on my left leg from my right. So, walking with that much of a difference in limb length can offset your hips. And I didn't feel uncomfortable after getting off the table, and I was able to move around more freely. I felt more alert and, like I said, rejuvenated and energized, and it was really helpful.
Did that mean pain reduction also?
Yes, and now that I know more about light therapy, that has to do with your improved circulation, because pain and inflammation are partners, as I learned at Solace Academy, and through the trainings of my mentor, Tinka Smith. So yeah, it did help with pain reduction and overall muscle relaxation for me. And that's what really motivated me to become more of a part of this wellness community and be active, not only as an advocate, but as a practitioner. Because if I can help somebody by giving them that same experience or a similar one, then that means so much to me. There's so much joy in that, and that's why I do what I do.
Yeah, I can imagine. Not to get too rudimentary again, but I just want to paint a picture also for the audience. What is it like? Are you like stepping into a tanning bed, or are you under like some heating lamps, or what is it like?
Well, there are various different light devices. The light device that I use LED light pads, and that you just slip under the body. For a basic layout, you would put it, for the most part, along the spine. I can wrap it around limbs if you're having certain spot pain or certain pain in, areas that can easily be isolated, like limbs and so forth. And so it's not quite like being on a tanning bed at all. They're just small pads that can be placed on the body.
Do you see light coming out of them?
Yes, you do. So I usually cover my clients with a blanket to block. And as long as you don't have any past history of seizures or epilepsy, you do have a light mask. And for me, the light mask is very soothing, but for others, it's not. So it's really preference. And, light sensitivity is what I've come to learn, a sign of how much, you need light, because especially nowadays, everybody's in buildings and exposed to artificial light, be it on our computers, phones, tablets, or, fluorescent lights in our workplace or school. And so, we're really deprived of natural light.
So am I understanding correctly that one of a symptom you might experience if you actually need, or you could benefit from light therapy, is if you're sensitive, your eyes are sensitive to light?
Yes, light sensitivity. But, there are various situations where applying light to the eyes would be appropriate and some that would not. And so that's why I treat everybody as an individual, when they come in and want to learn more about light therapy. And then, of course, using the frequencies, it's a little different from the light boxes or the light masks that you can get over the counter at Bed Bath & Beyond or Walgreens. But it's good that there's rudimentary products out there that are accessible to the public.
Is it easy to explain in a here, like what would be the difference or main differences from these commercially available?
The frequencies or pulses per second. The most light devices that you're going to see that are on the shelf or over the counter are purely just light. They don't utilize different colors, and if they do, it's a very limited spectrum, and they don't have the added benefit of the Nogier or Sophigo frequencies, which are pulses per second, which resonate with the human body. And for anybody interested, that's kind of diving more in depth, I would just encourage you to look up Salvaggio and Nogier frequencies and check out my website at lifestruecolors.com.
You're segueing
for more information.
We'll have these links, of course, in the show notes.
Yes.
But that's a perfect segue, because it sounds like you could just talk for hours and hours and hours on these topics. Not just you, but there's so much in these topics that obviously you have experience with.
Yes, there really is. And before we started the podcast, I recall you stating that, everybody finds something for themselves, and it really is a personal journey. So I would encourage anybody listening to this, whether they're thinking of themselves or a loved one or just somebody they know, encourage them to explore and find what works for them and speaks to them, and, just do for you. Or if you're thinking of a loved one, encourage them to do for themselves.
Those are great closing words. You read my mind of sending a closing message. That was beautiful.
Oh, thank you.
So we got your website, a beautiful closing message. I do have to ask, though, is there anything else you'd like to share?
I do have another parting message here, and I just, I just hope that my story can be helpful. I'm not trying to convince anybody to go out and seek out any sort of treatment or modality I'm just speaking from personal experience. The one thing I do encourage is for people to, just treat themselves with respect. Remember that no matter what you're going through, it's your life, and everybody has the right to choose what's best for them.
Definitely. So on your website, people can connect with you there and find out more. And thank you so much. I'm so glad that we were able to connect and do this. And we'll definitely be in touch because I want to hear how things are going. And I know you'll have more to share in the future.
Oh, yes.
Inspire.
Yes. And I'm very grateful to have met you. You're an amazing woman. And thank you for this opportunity.
It's my pleasure. I have a feeling we'll be in contact and doing more in the future. And I also want to, at the conclusion here, I would also invite guests to visit weightfreewellness.com. You'll find more inspiring podcasts, and I'm working on more and more helpful and inspiring guests. And also join the newsletter. And, that might be old hat to hear that, but I'm going to explain a moment just why you'd want to join the newsletters. Because even when we connect on Facebook and Instagram, with all the algorithms, how they control things these days, you may not see all the posts and the great interviews that we have to share. But if you subscribe to the newsletter, I don't barrage you with emails, but it's the one way to make sure that you will hear about the guests, inspiring and helpful resources that of people that I'm so excited to find and meet. So thanks again, Jessica, and I look forward to talking in the future.
Thank you.
Bye-bye.
Bye.